The dangers of this drug, prednisone, in our pets, and alternatives you should seriously be considering.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
I'm going to share with you the serious side effects that a dog parent had. The last thing you ever want is for this to ever happen to your dog. Prednisone, the corticosteroid, it can be effective in our pets. It can have serious long-term consequences. Your dog has been diagnosed with an allergy, excessive itching, recurring ear infections. We've got the answer. Prednisone. Maybe your dog's been diagnosed with an immune-mediated skin disease. I know the answer. Corticosteroid. Prednisone. Maybe your dog's been limping a bit of a swollen joint. I know a quick fix. Let's give him an injection of this drug. Prednisone. You have a cat that's been coughing, been breathing heavier. Your cat likely has feline asthma. I know the answer. Prednisone. Or a dog or cat with ongoing GI disease, vomiting, diarrhea, weight loss, perhaps inflammatory bowel disease. We got to suppress that overactive immune response going on in the intestinal tract. Let's pull out this drug, prednisone. And when I started out in veterinary practice, in some cases, you had an animal that came in and they weren't just quite right. Like, I don't know, he's got something going on. I was actually taught by my very first mentor in veterinary medicine, when in doubt, pull out the steroids, give some prednisone. That's just how commonly this drug is being used in veterinary medicine. Sure, it can provide some short-term relief, but in my opinion, many of the times, the long-term risks, they way outweigh the benefits. Some of the common side effects, especially in our dogs: increased drinking, increased urination. Some cases, it's just excessive. They just won't stop drinking. They just won't stop peeing, even in the house. They just want to keep eating and eating by the effect of the steroids stimulating their appetite. You get a marked increase in them trying to beg, get food anywhere. They're also more likely to gain weight. It can markedly suppress your dog or cat's immune system. They are much more likely to get secondary infections. Many of our animals, especially our dogs, they can suffer from muscle weakness, a loss of muscle mass. It can affect their tendons, it can affect their ligaments. They're much more likely, for instance, to have an ACL tear. That's a horrible knee injury that could cost you thousands of dollars. In some cases, they can get this thin, chicken-like skin, marked delayed wound healing. You can get generalized alopecia, this generalized hair loss. It's not uncommon to see behavioral changes in our dogs. These dogs can be more anxious, pacing, restlessness. And in some dogs, they can actually become much more aggressive. You can have a dog that's normally calm and friendly. All of a sudden, he may growl, bite at his owner. Stomach issues are common secondary to the corticosteroid prednisone. Then there's the serious long-term complications. And these can be conditions where you just can't reverse. So one big example, which I saw more than a few times in veterinary practice, be a cat being treated for feline asthma. He's been given a prednisone long-term because that's kind of, one of the specific treatments for any of our cats that have asthma. They're coughing, respiratory distress. And what can be the big side effect? We can turn these cats into diabetics. And I've exactly seen this. These cats being given prednisone, they develop diabetes. And once that happens, in many cases, what's the answer? You need to have this cat now on insulin. So you've tried to treat one condition with a drug that has some pretty serious, big long-term complications. Now you've created an even worse condition. Now you've got a cat that is a diabetic that needs long-term insulin, all as a result of that steroid. It can affect your dog or cat's pancreas, can affect your dog or cat's liver. And here we can see serious long-term complications. It can cause a dog to have chronic pancreatitis, acute vomiting, acute diarrhea, but can be ongoing intestinal pain and discomfort as a result of the steroid. It can be affecting the liver, elevated liver enzymes, long-term liver damage. There's a disease called Cushing's disease, which is usually caused from a pituitary tumor. A gland from the kidney called the adrenal gland produces too much cortisol. It'll cause these dogs to have increased drinking, increased urination, increased appetite. This distended swing belly, usually is bilateral symmetric hair loss, secondary immunosuppression. But with your dog being on a corticosteroid like prednisone, you can actually cause Cushing's disease. and you do not want that to happen. Yes, prednisone, it can have some big serious side effects. In some cases, there's not many options in veterinary medicine, but even if that's the case, you just want it for short-term use. You don't want it for long-term use. Unfortunately, and too often, that's not what happens. Big example that I need to share with you guys was shared to me by a pet parent. Their dog was prescribed prednisone because he was itching, he was scratching, likely had an underlying environmental allergy. One of the quickest ways to quickly stop that itching, give him an injection of a steroid like dexamethasone, follow him up with prednisone at home. Maybe he's on 25 milligrams twice a day. Works really quickly to stop the itching, but it can have serious secondary side effects. So what happened with this dog is not only did he have increased drinking, increased urination, he became completely incontinent. He was just lying in their house on their carpet. He didn't even bother to get up. He just would urinate all over the floor. So here's a dog, had no other underlying health disorders, was diagnosed with environmental allergy, prescribed prednisone, became completely incontinent. I'm hoping that after the dog is off that prednisone, after a period of time, he's going to regain his continence. But that doesn't even always happen. And the last thing you want is your dog to be diagnosed with a, relatively benign condition, like just itching. Your dog gets on a corticosteroid, and all of a sudden he's got pancreatitis, he's got liver disease. I mean, your cat is given an injection of dexamethasone and he develops diabetes. My point in all of this is be aware of the alternatives. Do what you can to minimize the risk of your dog or your cat ever having serious side effects like some of the ones I just discussed. I'm going to first show you a couple of conventional options with lower side effects, and then some of my top natural alternatives to prednisone. If you've got a dog that is seriously itching, you feel that a steroid is important, or your veterinarian says, let's get him on a corticosteroid, why don't you try a topical version first? Far lower incidence of side effects. This is the OTC 1% hydrocortisone. Apply this topically to the area of affected skin. Way lower chance of secondary side effects. There are other stronger veterinary versions, and in all instances, something you're going to apply topically is far safer than anything you're going to inject into your dog or cat or give them orally. Number 2, especially for an itching dog or cat, this is the OTC antihistamine cetirizine. The brand name is Reactin in Canada, Zyrtec in the US. It works reasonably fast to decrease the itching, very safe for both our dogs and our cats. A standard dog and cat dose, 0.5 milligrams per pound, meaning a 10-pound dog or cat, they'd be getting 5 milligrams or half of one of these 10 milligram tablets. That only needs to be given once daily. The two obvious conventional options with far fewer side effects. What about some of the holistic alternatives? Well, for an animal that is itching, an animal that has autoimmune disease, an animal that has inflammatory bowel disease, consider this. The root of the licorice plant, licorice root extract. It's one of the most widely used herbal supplements in Chinese medicine. It literally has hundreds of studies and has got clear and documented immune modulatory properties. What that means, it can decrease an overactive immune system. And for majority of times, we're giving something like a corticosteroid, prednisone. We're doing it to suppress the overactive immune response, whether that be for a dog that has allergies, whether it be for a cat that has feline asthma. We're going to decrease the inflammation in the skin, decrease the inflammation in the airways. Licorice root, it can do exactly that. Big caveat, it's not going to work near as fast as the corticosteroids, and it is meant for only short-term use. Pretty standard dog and cat dose, about 1/4 of the ml of the tincture, which is about 7 drops, once or twice daily for a maximum of 14 days. Usually we'll do 14 days on, 7 days off. The omega-3 fatty acids, such as our krill oil supplement. The EFAs, they really are great long-term anti-inflammatories, really important in any animal that has an allergy, whether it's a food allergy, whether it's a flea allergy, whether it's an environmental allergy. Important for any underlying inflammatory disorder, especially when we have animals that have asthma, for instance. In all those cases, your dog or cat can benefit from a good quality EFA supplement. When we're dealing with acute allergic reaction, a marked inflammatory disorder where we need some immunosuppressive, some marked anti-inflammatory action, you need higher doses of the krill. So we're looking at doses of 500 milligrams per 15 to 20 pounds of body weight, once or twice daily. Some of the non-psychoactive components of the cannabis plant, the cannabinoids, CBD, CBC, CBG. Those are all in our ultimate cannabinoid blend. The primary way they're working is they're targeting CB2 receptors, These are cannabinoid receptors found all throughout our body, all throughout our pet's body. What they do is they're binding those receptors. We're seeing decreased inflammation. We're seeing modulated immune system. So this can be really helpful for animals that have allergies or animals that have autoimmune skin disease. If you've yet to try it and you want to maybe even try to lower the dose of the steroid you're on, then get your dog or cat on something like this, a cannabinoid blend. A standard cannabinoid dose is about 3 milligrams per 10 pounds of body weight. We want to be giving that twice daily when we're dealing with an overactive immune response. For allergies, for an overactive immune system, we want to consider natural antihistamines. Could be this nettle or even this nature's Benadryl, also known as quercetin. This nettle leaf. Nettle is that green weed which has little stinging parts on its leaf, found all throughout different parts of the world. We used to just think about it as a weed, had no medicinal benefits. Turns out it's got an array of different medicinal benefits. It's rich in vitamins, rich in minerals. But not only that, it has some great nutrients which have powerful healing properties. It is rich in things called flavonoids. In particular, it even has quercetin in it. Studies on people with hay fever, they've shown that nettle supplementation, it can decrease some of the allergic signs. And nettle's been successfully used for animals that have allergies, decreasing the itching. Typical nettle doses, about 100 to 200 milligrams per 10 pounds of body weight. That can be once or twice daily. And I wanted to show you, here's this nettle tea bag. So you can just make a cup of nettle tea and just use that for your dog's water as opposed to giving them water. It's a great way to substitute nettle. A cup of nettle tea a day, doesn't matter what the size of the dog, will do no harm. But if you wanted to give the nettle as a herbal powder, we have the leaf ground up here. That's what turns into the tea. Each tea bag here, it's about a teaspoon or so. It has about 2,000 milligrams. So I'd be giving about a quarter of this per 10 to 20 pounds of body weight daily. Allergic animal, you want to get them off less steroids, substitute water for nettle. Or this, quercetin, concentrated flavonoid, one that is in apple peel, one that is red onion, one that is even in nettle. Oh, it's this awesome flavonoid called quercetin. It's been extremely well studied for allergies, shown to be a natural antihistamine, meaning that it can decrease histamine release from mast cells. Less histamine, less itching and scratching. And that's what we're trying to do. So in part, we can use the prednisone, that strong steroid, to suppress inflammation, block the immune system. Or we can use something from a flowering plant with far fewer side effects, will not suppress your dog's immune response, won't turn your dog or cat into a diabetic. Standard doses of our bioavailable quercetin, it is 50 milligrams per 15 pounds of body weight daily. I want to mention a herbal anti-inflammatory spice you should really be aware of. Coming from the curried spice turmeric, this is 95% curcumin. Curcumin, it's got a pile of research showing to be a great natural anti-inflammatory. But one of the ways it can work for our dogs that have like an allergic skin disease, and we're finding that they benefit from cortisone, it can actually cause the body, when it's given, to produce its own cortisone. The curcumin, it can cause your dog to release cortisol from their adrenal gland. That's the gland in front of their kidney. And when they naturally release cortisol, they can have less inflammation, less itching, without you giving the prednisone, without turning them into something like a dog that has Cushing's disease. It's not just that the curcumin is anti-inflammatory, it also is naturally causing your dog to release his own cortisol. And when that happens, you can have the best of both worlds. You can have a dog that is itching less, not going to get some of those serious long-term side effects. I would suggest initial doses for a dog that's got the serious itching, 250 milligrams per 50 pounds of body weight twice daily after 7 to 14 days. Lower that to 250 milligrams per 50 pounds of body weight once daily. And lastly, I wanted to mention a supplement which I haven't talked about in terms of in context of something which is a steroid alternative. Something which can modulate the immune system and potentially really help your dog or cat without all the secondary side effects from the steroids. This is Mother's First Milk. We typically discuss it in terms of its immune boosting properties. Colostrum. Colostrum is there to help support a little newborn before they've got a developed functioning immune system. Think of it kind of like this super antibacterial / antibiotic, antiviral that's going to kill things before these little babies develop to the point where they can have their own functioning immune system. So we know it's got great immune supportive properties. We also know it can do other big things in our dogs and cats. It's been well studied, shown to be really beneficial for intestinal disease. It can aid intestinal healing. It can even prevent secondary side effects of the NSAIDs. When animals on colostrum, they're going to heal much quicker, less chance of getting secondary NSAID side effects. But there are ingredients in colostrum which can modulate the immune system. Number one, it has something called lactoferrins. And they've been shown to inhibit pro-inflammatory cytokines, similar to how the corticosteroids work. It also has immune modulators called PRP, proline-rich polypeptides. Specifically, they've been shown to decrease histamine release. When that happens, we have less itching, and that's a problem we see in our animals that have allergies. Lastly, the colostrum has got specific growth factors, great for gut and intestinal healing. And because of that, they're a great option if we have an animal that is IBD, inflammatory bowel disease. And instead of starting out with a strong corticosteroid, why don't you try a colostrum supplement first? Very safe. You're not going to harm your dog or cat by giving them colostrum. I would suggest a dose, especially when on a more serious immune-related disease, of 100 milligrams per 10 pounds of body weight twice daily. These, for instance, are 500 milligram capsules. So for Tula, I've been inclined to give her half a capsule once a day. Thanks so much for watching this edition of Veterinary Secrets of some of the serious side effects of prednisone in our dogs and cats. And then more importantly, learning about so many of the alternatives that you can use to help your dog or cat without using prednisone. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.